Boston area medical center shut down yesterday after a patient turned up showing symptoms of Ebola. Medical personnel sealed off the facility before moving the patient by rescue to the hospital. The patient had recently traveled to West Africa and complained of a headache and muscle aches. NBC 10's Olivia Fecto reports.
That patient came into Harvard Vanguard in Braintree complaining of symptoms. He was quarantined and then taken to Beth Israel Deaconess Medical Center in Boston.
No one's really told us what to do. They just said take a shower and check your temperature for the next 21 days.
Denise DiMarzio is 7 months pregnant and says she's concerned for her own health and her baby's. The man who came to Harvard Vanguard complaining of headaches and muscle aches was transferred to a hospital in Boston.
We have put the patient in a unit which is specially designed to protect the patient and staff.
Dr. Kenneth Sands told reporters the hospital is taking precautions just in case this turns out to be Ebola. The first step is an initial assessment of whether this should even be considered a suspected case of Ebola. After that, the hospital would perform tests in connection with the city of Boston and the state's Department of Public Health. In the meantime, he says they're simply trying to keep other patients and staff safe.
The ventilation systems are protective. And that the personnel that are in contact with the patient have special protective gear.
As for Harvard Vanguard, it reopened about 4 hours after shutting down. One woman said she didn't understand why the clinic hadn't shut down right away when the patient was there.
They should have had it closed off and not let anyone in, and then, you know, it's 50 more people that wouldn't have had to worry about this.
The hospital says even after what's happened in Dallas, it feels comfortable with the plan it has in place to handle cases like this one. Olivia Fecto, NBC 10 News.